Thank you very much for having me today. It's my pleasure. Today I'm going to present the research on scale drivers and the impact of immigration of health personnel from Bosnia and Herzegovina. Do I have to make a disclaimer? The research itself is also tackles the ICT professionals. Can you hear me?
Yes.
I received horrible echoes, so
Perhaps
not really sure.
The echo is. Sorry, we'll try to get the technical people to solve that for you.
Okay, I'll try to continue in the meantime. So, yes. Okay, so the research is part of the labor migration project, and the aim of the project is to contribute to Bosnia and Herzegovina government efforts to improve migration governance and to support their efforts to develop evidence-based policies related to migration of healthcare and ICT professionals. The project relies on three pillars, and basically there are three major objectives of the project. The research that I'm going to present today is the core, is the essence of the project, and the idea is to kind of like involve the government in understanding what is the scale, what are the main drivers, and what is the impact of migration of healthcare and ICT professionals from the country. So once the draft research will be completed, the idea is to validate its finding and results. Not only. Hello?
Yeah, it's working perfectly. Yeah.
Okay, super. So to validate the research findings, its recommendations and conclusions with the government, but also with a wider group of stakeholders. And based on that, to kind of like identify and support development and implementation of pilot initiatives which have most promise to address challenges arising from the research. The project started in 2019 in December, and it's supposed to be ended this year in November, but most likely we will extend it a little bit. So as said, the research focus is on health and information and communication technology sectors. And thematic areas that we really wanted to explore are immigration trends and demographic data of immigrants, drivers of immigration, and started with the research October last year. And we hope to have the first draft ready sometimes in April this year. It's speaking about the research, it's mixed methods approach. It's quantitative and qualitative. Well, for the quantitative, we've done a lot of literature review and analysis of official statistics. And for the qualitative, the key source is interviews with key informants. Speaking of key informants, we actually reached out to a number of health professionals, health employees, health students, recent migrants, government officials, and etc. Later on, I'm going to talk a little bit about the numbers and the results of the of the research. But speaking on selection of beneficiaries, it was proposed ensuring geographic diversity, gender, occupational skills, and experience, and given the certain methodological limitations, we decided to go with the snowball sampling for interviews with key informants. When it comes to the methodology, we looked at two official statistical sources, in-country and those that are of like international nature. As example, for country official statistics and administrative sources, we'll look at the market and education statistics, unemployment records, and data from bilateral employment agreements. As in the country, we don't have like data on exact numbers of migrants from the country. And when it comes to the international sources, we looked at statistics from the top countries of the nation. So we use the Eurostat reports, destination countries, official statistics, and OECD reports. As said, the main source for qualitative part of the research was key informant interviews, and we actually managed to have to reach out to more over 100 informants, which come from government, health, and ICT sector, employees and deployees, recent migrants, and experts. So when it comes to the scale of migration, I can say that in 2019, roughly 60,000 first permits for Bosnia and Herzegovina citizens was issued in EU 28 countries, which for country of official 3 million inhabitants is quite a tremendous number. Most permits issued relate to remuneration, and 84% of remuneration-related permits were for 12 months or even longer. And speaking of residence permits for remunerated activities, that number has significantly grown from 2011. And it's from 300,000 to almost 450,000 in 2019. And speaking of the structure, as said, the remuneration reason is the main one. But what really can be observed is that the family reasons is the one that really follows the remuneration, and which tells us that basically now the whole families are actually leaving. Education and other reasons are not so significant in the overall structure. Speaking of the health workforce migration, when looking at the OECD data, you will see that the numbers are fairly modest, and in 2019 we have close to 800 doctors and roughly 900 nurses residing in and working in OECD countries, of which roughly 70% can be assigned to Germany. So Germany is the most favorite destination country for Bosnia and Herzegovina health professionals. But when we look at the different sources, and given that Bosnia and Herzegovina has got bilateral agreements signed with Germany on nurses, we have a completely different numbers. And since 2013, roughly 6,000 nurses have migrated to Germany. So we are trying really to understand, how those numbers also fit. And the source from German Labor Office tells us that we have roughly 16,000 health professionals from Bosnia and Herzegovina actually existing in the German employment in the labor market. So most of the migrants who actually leave, nurses who leave to Germany are actually under 30, and 90% of them are actually female. And basically, those are the most reliable, that's the most reliable source for us in terms of just understanding who actually and what is the structure of those who left the country. We also try to understand a little bit better, what are the key drivers, what really motivates health professionals to leave the country. And we kind of like grouped main drivers into three categories: political and legal, economic, and social. Political and legal are actually the most prominent, and under this we have like a political uncertainty and corruption as the most prominent reason making health professionals leave. They really identify corruption, political clientelism, patronage, use of family, and political connections to advance professionally as the key reasons. So to migrate to other countries. So in simple terms, they really want to see a less corrupt society to actually stay in the country. Okay. I don't know what happened. Sorry. Hold on. Okay. So also, on the other hand, we have to acknowledge that facilitating legal framework and recruiting policies of destination countries play a very important role. So, for example, the Germany recruitment policies are definitely tailored to attract a lot of professionals from health sector, not only from Bosnia and Herzegovina, from Western Balkans, and from rest of the world. So this legal framework and recruiting policies are actually playing a major role in migration. On the other hand, when it comes to economic reasons, sectoral unemployment play a very important role in migration of health professionals, especially in terms of migration of nurses. Which is not so much present in the case of doctors, who are very often leave senior positions when decide to migrate to other countries. Wage differentials definitely play important role, and also working conditions and career advancement are one of the main drivers among health professionals. For example, people actually complain quite a lot about working conditions, like workload, basic hygiene, and like basic working conditions, such not having even like appropriate equipment and etc. Also, they bring up pension system, and they kind of like display a lack of belief that one day they will actually be even in position to receive their pensions. And interesting that pension system plays a very important role in terms of like their decision to migrate. And finally, the education media bias. People feel that they are very like poisoned, so to speak, by media, and exposed to like overall negativity in the society. And that's another reason why they decide to leave. And finally, the family, they want better life for their family, and that's exactly why they decide to migrate. So in terms of impact, I think it's quite interesting that the feedback that we got from different groups differs a little bit. On one hand, you have patients, you have health professionals who actually recognize overall deterioration of quality of services, while at the same time managers of health facilities do not recognize that as such a prominent phenomena. And basically, the reduced access and availability of care is just another important impact of migration. Many say that, especially in rural areas, this phenomena is more present because in urban areas, they get easily, or they tend to more easy replace health professionals than its case in rural areas. And what's actually the most important finding, though it's a very difficult to prove, is that there are bad treatment results, there are late diagnosed diseases, late start of treatment, and in some cases, it's prolonged treatment period, which definitely can be attributed to lack of human resources, but also the quality of health staff available in those facilities. And once again, just to outline, this impact differs, and it pretty much depending on level of medical care and location, and it's more present at the secondary and tertiary level, and in rural areas than in urban ones. Okay, so as said, the research is actually still in progress. And at the moment, we are doing a peer review, and I will be happy to actually do a follow-up with you and share a more detailed findings in coming period. And we hope to start with study validation sometimes in April, and hopefully have this process done by fall this year. After, we will be able to disseminate report, and we'll be happy to share it with you too. So that's pretty much it. I'm happy to actually answer any of your questions. And in the case you want to know a bit more of about the research, here is my email. So please feel free to write to me, and I'll be happy to share any information, any relevant information with you. Thank you very much.